Welcome, everyone. We're so excited to have you here to talk about one of my favorite things, which is the hot topics in cosmetics. And we have none other than the extremely talented Dr. Adam Mamelak here with us today. And if you don't know him already, shame on you, but he is the OG founder of Sonova Dermatology in North Austin, which has been open for almost a decade, which is super exciting. And we're so happy to have you here. And not only is Dr. Mamelak a cosmetic expert, he also has a finesse with skin surgery and Mohs surgery, which are fantastic offerings. And we couldn't be happier to have him here today with us.
Thanks, Taylor. It's a pleasure.
Yes. So, as we said, we're going to talk today about hot topics, which is so hot. And so we kind of broke this down into different sections to make it a little bit easier to digest. But the first one being contour is key, which is key. We're going to talk a bit about full correction and then a couple of different areas that assist with the contouring aspect. Then we're going to have rested and ready, which I think all of us could really appreciate, which specifically has to do with the under eyes. And then level up, which is going to talk about specific hot spots on the face and body that we can focus on to, enhance and anti-age, which we're all looking for. But without further ado, Dr. Mamelak, kick us off.
Well, thank you, Taylor. It's an absolute pleasure to do this web recording with you and to talk about some of the newest, hottest things in aesthetics and aesthetic medicine. We wanted to talk about contour, and nowadays contour is key. You know, Taylor, the fact is we've come a very long way in aesthetic medicine. There's been an evolution in aesthetic medicine in our understanding how the face and how the skin ages. Now, I don't think I'm alone. We've all done this before. We've looked in the mirror and we've said, oh my God, I've become my parents. There's genetics here involved, and we do see changes over time. You know, initially we were so focused on the skin. The skin is changing, the skin is getting loose, there's laxity, we're losing our elastic fibers. And then there was all this talk about muscles, muscle movements, muscle definition lines and worry lines. And now we have yet another understanding of the different planes in the face and the different tissues in the face and how they change over time. So when we look at people's skin and we look at the aging face, we are much able to specifically treat different areas and address certain areas to really enhance our rejuvenation and to get better outcomes. You know, we do see changes over time. I mentioned the muscles and muscle movements, and we know about definition lines and worry lines, the so-called 11s that come from overuse and overactive muscles. This was real hot. 20 years ago, someone came out with this idea of a little toxin, a tiny little injection that would relax our muscles and make all of our worry lines go away. Well, it was pretty significant, and it revolutionized the way we were approaching facial aging at that time. Now we're looking at more subcutaneous tissues. All of us in our skin, no matter how fat or skinny we are, we all have these anatomic fat pads that over time do change. They thin over time and we lose volume in the face. And with the help of gravity, they also go down over time and sink over time, and leads to the droopiness or sagginess that we often see. It accentuates hollows in our skin. It accentuates our smile lines and our marionette lines, and really contributes to the aging face. And we are much better at addressing this now than we used to be. And that's where contour comes in. Because when you look at the face and you think to yourself, well, there's some sagging going on, it's not skin laxity. Both of these patients have beautiful skin. What we're seeing is we're seeing a descent of those subcutaneous fat pads and thinning over time. And sure enough, by restoring the volume to the areas like the cheeks and the under eyes, we can really enhance people's looks. We can really significantly contribute to rejuvenation just with some simple injectables, for example, displayed here. Here's yet another example. Very nice young woman, already a very attractive young woman, came in and said that She looks tired all the time and wants to address it. Well, certainly by using a little bit of filler in her tear troughs, in the cheeks, and in the nasolabial folds, we can just soften her appearance to the extent where it really does take years off. Not a lot of product, not a lot of, no surgery involved, minimally invasive procedures just to enhance these patients' looks. Another patient in male patients, he said that he looked too slim. He was concerned about his profile and looking a little bit gaunt. And he said all of his friends say that he looks so skinny all the time and doesn't look as plump and as rejuvenated as he did when he was a kid. Well, again, we used a little bit of filler in the cheeks, in the tear troughs, and also along the jawline to help enhance his profile and to help make him look younger and more youthful. Now, how much do you need? Well, when we understand these changes that happen, when we understand how these fat pads move and how the muscles contribute to this, a little goes a long way. So we don't have to do extensive surgery. We don't have to do massive renovations just to get a little bit of enhancement. You can see that just by using 1 or 2 syringes, we can get significant results, whether it be in the cheeks to give lifting, in the lips to give more augmentation or advance or enhancement, or in those smile lines to help us fade so it doesn't look as severe in our appearance. So we have to also understand that one size doesn't fit all. And I know everybody always says this, but really individualizing treatments is key. How much do you need? Well, it really depends on you. It depends on what your needs are and what your goals are. And nowadays, we're more focused on full correction and full facial rejuvenation. So we're not just going after the smile lines, we're not just going after the lips, but we're looking to enhance the entire face and to rejuvenate the entire face and the entire appearance. And by specifically using fillers in combination with toxins and other resurfacing modalities, we can get significant results just by using targeted treatments to really enhance the face and enhance these areas. Again, already a very youthful looking woman, but with a little bit of voluma in the cheeks, we can see how the contour and restoring contour in the upper cheeks and in the upper face can just enhance this woman's profile so much.
Dr. Mamelak, I have a question for you.
Yes, sir.
So tell me a little bit more about why going the route of full correction would be the most beneficial for a patient.
Well, it's interesting because I was about to touch on that, Taylor, but we're at this slide where we talk about balance. And the fact is we're so, nowadays what we're looking for is we're looking for natural results and we're looking for full balance. Back in the early days of Botox, the technique was to paralyze people's foreheads. You wanted to see no movement whatsoever. And people knew, they called it the Botox look. We don't want to do that anymore. We want to soften the appearance. We want to use this adequately to get the results that we want without making people look severe or strange. The same is true with these fillers, and the same is true with volume. Back in the day, people had those big apple cheeks or those big severe cheekbones that looked a little unbalanced. And nowadays it's about balancing the face and making sure we address all the areas people are concerned about. The lower face is included in this, so we can't ignore that. And this is probably one of the most interesting things that I find. So we talked about muscles, we talked about skin laxity, and we talked about these subcutaneous fat pads that migrate over time. Well, believe it or not, your bones change over time. I mean, when we're younger, we see these very defined mandibles, these very defined jawbones. As we get older, look what happens. We lose the angularity of our jawbones. There's a softening and there's an elongation of our jawbones. We lose our chin. The distance between the nose and the upper lip elongates, and it leads to a much not as defined profile. And that often contributes to jowling that so many patients are concerned about. So when we have this, we no longer just start plumping up our cheeks with the hope that's going to lift up everything on the face, but we can actually address these areas. And this is the perfect example. A little bit of filler in the chin and along the jawline can really help define the mandible, define the jawline, define the difference between the face and the neck and restore contour to this area and rebalance the face. Here's yet another example. This is a younger patient, but with a slighter chin. By bringing that chin forward so it's more in line with the lower lip, and by using a little bit of filler along the jawline at the angle of the jaw, we can better define this, define the face and differentiate it from the neck and give a much more youthful and much more attractive appearance. Now, it's not just filler. We do have other techniques at our disposal. I've been talking a lot about injectables, but the fact of the matter is we have a lot of toys in our clinic. This is a treatment called Ultherapy that uses a high energy device to tighten the skin, particularly around the neck, the lower face, and even around the eyes. And there's not just devices available, but things like Kybella, another injectable that helps dissolve that subcutaneous fat pad, make it dissolve to better define the jawline. So we have a lot of things at our disposal nowadays, and it's really about individualizing the treatment, combining these different approaches to really go after what the patient is looking for, optimize results, and use very targeted therapies to give patients what they need.
For sure.
So
and I was going to
now,
say,
Taylor,
moving forward, that I think that one of the most important things that people are looking for is wanting to look well rested, because not everyone is necessarily looking for the defined jawline. They may not be looking for some of the other things that you're mentioning, although they may be kind of a ancillary thing that comes along with it. But tell us a little bit more about how we can look rested.
Absolutely. Well, I don't know, Taylor. You know, I always get at least 7 or 8 hours of sleep at night. I'm always undisturbed. I'm never stressed. Never in my life do I wake up thinking, oh my gosh, I look so tired. So let's face it. We're all very busy people and we're all have things to worry about. And sometimes it does show in the face. And the eyes is one of the most significant areas where people talk about kind of aesthetic concerns, looking a little bit run down and wanting to do something to kind of ease those dark circles or the fine lines that are developing. And nowadays we have so much at our disposal to do this again. And it's about targeted therapy. So again, we could use fillers and we can use products like Restylane or other hyaluronic acid fillers just to put in the tear troughs and to augment the face on the upper cheeks and in the eyelids, just to give a much more well-rested, much more smoother appearance. Again, that Ultherapy technology that I was talking about that's used to tighten the skin, certainly we can use it on other areas, not just the neck and the lower face, but even on the brow and under the eyes to give a more tightened appearance. This was done just with the Ultherapy. There's no filler here in these photos. And yes, actually, speaking as a skin surgeon, sometimes we want to do something a little bit more dramatic. This is a lower blepharoplasty surgical procedure or lower eyelid tuck, where we actually did remove excess skin under the eyelids to give this woman a much more enhanced appearance. She was concerned. She had tried many techniques with fillers and other resurfacing agents to get rid of those fine lines and wrinkles on her lower eyelids, and finally decided that she wanted to do something a little bit more severe. This was done under local anesthetic. This patient was not put to sleep in an OR. She had stitches under her eyes for about a week, and look at the phenomenal results we can achieve with these minimally invasive procedures right here in the dermatology clinic. Now, the eyes are one of the things that show us, our well-rested things. But nowadays, we like other things. We want a little bit of a wow factor, Taylor, and that's where we get to the level up. One of the hottest areas, and Taylor, you'll agree with this because you keep up with the Kardashians just like I do, are things like the nose. So this patient came in and she was complaining because her nose had a downturn look, a little bit of a hook nose or a flattened nose. And she really wanted to do something, but she wasn't ready to undergo surgery for a rhinoplasty. So she asked about a non-surgical nose job. And that's exactly what we did here. This was done with filler. And look what we did. We augmented the tip of her nose. We raised the tip. That downward turn to her nose, or the hooked nose, is much more flattened, and we've improved her profile dramatically. This was done in the span of about 10 minutes to give her this look. And of course, as you know, the fillers typically last anywhere from 12 to 15 months in this area. So she's very happy. It's a once a year procedure that she does just to retain this profile. And of course, the lips. The lips are the big wow factor nowadays, Taylor. And I think initially this was done in older patients. Women would come in and talk about how their lips were thinning over time, how their lipstick would bleed and maybe go into their lipstick lines, and wanted to do something. But the fact of the matter is lips have gotten the attention of younger and younger patients. And now women want the wow factor. So we have patients like that already have extremely pretty lips, a nice shape to the lips, but just want a little bit more. And with a little filler, we can just give a little bit of augmentation, a little bit more fullness, just to highlight that. With a little bit of lip gloss or lipstick, I mean, there's a wow factor here, and I hope you agree with that. And then, of course, there's the real wow factor. Again, a younger patient, she came in and she wanted to make her ex-boyfriend jealous. And I said, what can I do to help you? She said, I want those lips. That's what he loves the most. Already very pretty lips, already very full lips, but look what we can do with a little bit of filler. This was done with less than 1 syringe to give her this kind of augmentation. And I hope you agree, this is a little bit of a wow factor. Again, very popular in probably younger patients and younger women. Older patients still want to have a little bit more definition of their lip line, take away some of those kissing lines or smoking lines that can develop over time, which can equally be done with filler. Taylor, it's time to move down to the body.
You used my photo. This is me.
Is that you?
It's me. We used my photo.
Interesting. Well, listen, you don't need mom jeans. I'll tell you that, Taylor. You're doing real well. But you know, we talk so much about medical aesthetics and facial rejuvenation, but we can use these techniques on the body now and use them very, very effectively. Again, it doesn't have to be surgery. No one has to go under the knife in order to get great results. And we can do things on the body, like take away that little bra bulge or the bulge under the armpit using Kybella, the same injectable that we used under the chin to help define the jawline. Well, we can use it near the underarm or even around the belly button, which I like to call Kybelly, to help decrease some of that extra fatty tissue and give better contour to these areas. Sculptra is another filler that has been used for years and years for facial rejuvenation to really restore volume with great longevity. Can last up to 3 years when it's placed in the skin to restore volume in the face. Well, believe it or not, Sculptra does an awesome job off the face as well. Things like that crepey appearance to around the knees, on the arms, or even on the neck and the décolletage area, we can use Sculptra to help tighten that skin and give a much more youthful appearance to the skin. And of course, probably one of the things that Sculptra is getting the most attention for now is the non-surgical butt lift or buttock augmentation. Sculptra can be used in a very defined area to help correct that hip dip, that the lateral kind of depressions that many people have on their buttocks. It can even enhance projection of the buttocks as well. These are small injections, no surgery, no fat grafting, no silicone implants, but just using filler to augment these areas and give a little bit more lift, some better contour to the areas, and to kind of augment this area. All done in the clinic, probably takes 15 to 20 minutes to get these kinds of results. Since we're in the area, Taylor, let's talk about other things that have to do with the bottom. And probably one of the hottest things that's come out in the past year is these treatments for cellulite. Now, cellulite has been one of the biggest issues we've had in aesthetic medicine. We have tried and tried and tried, and we haven't had great treatments for cellulite. We've done surgery, we've used creams, we've used lasers and other treatments, but it's been stubborn. And it's something that people are concerned about, something that diet and exercise don't help. And many, many people are self-conscious about these ripples or cobblestone appearance to their skin. Interestingly enough, this is a much better concern for women than for men. And there's an anatomic basis to this. Cellulite occurs because of fibrous bands that tether the top of the skin down to the muscle and the fascia underneath it. Of course, in between the top of the skin and the muscle and fascia is a layer of fatty tissue. And what happens over time is that fatty tissue herniates upwards and makes a bumpy appearance on the skin. Well, sure enough, those fibrous bands in men crisscross each other and hold our skin flush to the underlying fascia and muscles. In women, they're more perpendicular, and it allows for this herniation to occur much more frequently, which is why we see cellulite so much more common in women compared to men. And that's where Quo came along. So Quo was released last year, and I always like to say, whoa, Quo. Just my little thing. So Quo is an injectable medicine that helps dissolve those fibrous septi that tether the skin down and create this cobblestone appearance. It's typically done in a series of treatments. Usually we recommend 3, and each treatment is done about 21 days apart. And the full effects of this is usually seen a month after your last treatment. The injections are easy. You don't need any local anesthetic. You don't need, you're awake the whole time. We use basically acupuncture needles to do this. And in this area, particularly on the backside, you don't feel much to begin with. So it's done in a very comfortable way. But what the Quo does is it helps dissolve those fibrous bands that pull down the skin and tether down the skin, allowing the skin to relax and to smooth out the appearance on the top of the skin. It's actually pretty dramatic how effective this technique is and the results that you can get. So here's an action shot of me complete in my COVID gear, injecting Quo into this patient's thighs, because you can do the thighs as well, which is another troublesome area. Typically when patients come in, we take photos of the area, we circle the areas that need to be treated, and then we photograph the markings as well. As I mentioned, there's no numbing. The injections themselves take about 10 minutes, and then we usually schedule the second or third treatment at the time of the visit to make sure we're following the series accordingly. This is just a little video to show you how invasive these injections are. I personally really like the background music because that makes me feel that the rejuvenation is doing even better. But you can see tiny little injections in the skin, 1 pinprick per spot that we're treating. And again, just doing different areas, and in a second it's done. Oh, hold on. So what should you expect? Well, I'm not going to lie. The results are phenomenal, but there is some bruising, and the bruising is really what is the biggest thing. So everybody thinks about this in the spring and the summertime, but the fall and the winter are really the best times to do this. The bruising typically resolves over the period of about 10 to 14 days. So about a week and a half to 2 weeks to get the bruising to resolve, but it can be pretty significant. And it's part of the process. It's breaking down those fibrous bands. The skin is evening out and smoothing out over time. So we have to expect that. Now, as far as other downtime is concerned, there's no pain, there's no restrictions. You can get back to work, you can get back to the gym with no trouble. It's just to know that this area is going to be bruised for a while, so you might not want to do this the weekend before you go to the beach. How does it look? Well, the results are pretty phenomenal. This is a patient that had all 3 treatments, and you could see the significant reduction in the dimpling, in the cobblestone, and the rippling appearance to the buttocks. Here's another patient in her 40s. Again, after 3 treatments, significant reduction, better contour, smoother skin, much more confidence wearing a bathing suit or going to the beach or going to the pool after these treatments are done. This is our own patient. This was after 1 single treatment, and you can see how dramatic it is just after 1 treatment alone. Didn't even complete the series of 3 treatments, but you can see how it helps contour and decreases the rippling almost immediately after the treatment. And here's that same patient's thighs. And again, you can see the significant reduction in the cobblestoning and rippling of the skin with these treatments. Of course, like on the face, we do combine treatment, individualized treatment, so we know that patients are getting exactly what they need. We can use L-therapy on the body. There's other treatments as well, like Expo and also cool sculpting that can help better contour and augment kind of body areas. But certainly these are some of the newer treatments that have come out, like Quo and using Sculptra off the face to really give patients what they're looking for and to help optimize their results. And Taylor, that's what I got for you. Those are the hottest topics in aesthetics right now, happening right here at North Austin.
I love it. I love it. I am blown away. I mean, I've already made an appointment while we were here because I'm ready, ready, ready. But I think these are super exciting things, you know, contouring, looking your most rested and, you know, enhancing specific areas. I think those are some of the biggest things that we're hearing about in dermatology and aesthetics. And I just really want to thank you so much for taking the time to chat with us today.
Absolutely. It's my pleasure, Taylor.
Awesome. And then one thing before we go, I must say, and I think that you'll agree with me, that consultations are key. The most important way to figure out how to treat your aesthetic concern is to partner with an expert in dermatology and aesthetics, which we have quite a few of here at Sonova Dermatology, to figure out what combinations of treatments are going to best benefit you for your specific aesthetic concerns. So make sure you schedule your appointment, discuss your concerns with your provider, and we have, as you can see, a lot of options to help you, you know, feel your hottest. So
Absolutely.
thank you so much, Dr. Mamelak.
Thank you, Taylor. It's a pleasure.